welcome to Check 1 2, where we give you the lowdown on testicular cancer by talking to survivors, advocates and supporters of testicular cancer awareness here at the world famous podcast studio Glasgow. In this episode, we're thrilled to introduce Dr. Mike. Mike is a TikTok sensation, NHS GP and all-round advocate for men's health. Known for his engaging content and compassionate approach, Dr. Mike joins us to deep dive into the importance of self-checking and early detection, particularly around testicular cancer. You know, we explore the challenges facing the NHS and why Mike is so passionate about raising awareness of testicular cancer and how his platform is really making a difference. So tune in for an insightful conversation that could change your approach to your testicular health.
Well, you know what it's like at school. We don't get taught anything about stuff like this.
No.
Like you could rhyme off some absolute crap that you don't need to remember from like Pythagoras theory or mad geography stuff from when you were a kid, but nobody's taught you how to look after your body or how to check for testicular cancer. I mean, women are definitely better at looking for breast cancer, but we are far behind.
Probably about, I reckon about, it sounds extreme, but probably about 50 years behind.
Oh, absolutely. I know.
Because when you look at it,
like even when it comes to mental health and stuff like that, Scotland's always been far behind just because we think we still need to be manly men, but there's nothing unmanly about going to the doctor and finding a problem early, because we'll probably talk about it in the podcast about survival rates as well. It's crazy not to, or get your partner to check it for you,
exactly.
Make it fun.
I know, exactly.
But I'm sure we'll get into this when we're talking.
I think as well, it's like when like you kind of discuss that type of thing anyway, it's like it's always the education system, if they do talk about it, quacks it in between masturbation and STDs, and you're going, it's not quite the right.
Well, exactly. And if you think about the age, if it's the most common cancer between 20 and 40. So, like, if you teach somebody this at school when they're 15, it's still going to be quite fresh in their mind. Yep. Potentially when people are going to start discovering lumps and things. So, again, there's so much. I could talk all day about education in schools. I think we should be teaching people about the human body in general, how you look after it, when to know there's a problem for all different types of cancer, not just testicular cancer, but we should at least be telling people in easy ways the things that should be looking out for. But we don't.
No.
You know what I mean? Like it's crazy. Like when I was embarrassed when I started at med school. I realised I knew absolutely nothing about the human body. And I'm supposed to be, trained to be a doctor, turning up on the first day for an anatomy lesson. I'm like, I don't know any of this stuff. I never get taught any of this at school.
I mean, when, you got to biology, and I can remember my biology classes, but I can remember getting some bits about like reproductive systems. But then it became about like plant life, and you didn't really do much human biology.
Human biology. I remember at school I had to go to. They didn't offer it at my school, so I had to go to James Watt in Greenock on a Wednesday night for I can't remember what they called it, but it was like you were doing your hires, but out of hours type thing. So I would do like 3 hours a night on a Wednesday night every week. But that's how. You have to actually go out your way to be able to learn about the human body. It's mental.
They tried to do that with modern studies at Labour High. And I had to go somewhere else, and then eventually, because I was the only person who wanted to go, they went, we're not going to offer it.
I know, it's crazy.
So I never even got to do modern.
But it should be a non-negotiable. Everybody says that the NHS is broken, and it is, and for lots of different reasons. But I think one way that we could actually make it better is to educate people and empower people, and then you could use the system a bit better. Do you know what I mean? But we don't, and then the problem is that people can't get appointments and they just leave it, and I think that's what goes wrong with young guys especially.
Yeah, definitely. That's our rolling anyway. So,
we're going right.
So we'll kind of touch back on some of that stuff anyway.
Absolutely.
Thank you so much for coming on. I know it's like it's can be a bit of a kind of struggle getting kind of times to do this. So honestly, I really appreciate it. for people who don't know you, would you be able to kind of just introduce yourself, just a bit your kind of professional and kind of social background as such?
So I'm Mike. I'm a doctor. I'm from Largs originally. I went to uni in Glasgow. Worked in the NHS for about 7-8 years, and then moved to Australia, where I kind of mostly work, although I do come back from time to time and try and pick up shifts. I'm really passionate about teaching people about the human body and about disease and everything in between, and try and make it a bit fun, not just a very educational channel, but trying to relate to people and get people engaged. And so I started a TikTok channel a few years ago, and it's kind of just grown really, really quickly. Opened lots of doors for me that I never thought would be possible, which has been fantastic. But I'm still just as passionate now about it as I was when I started the channel. And I was having a look at what you guys are doing, and again, it's along the same lines as what I want to do. I want to give people the information so that we improve the outcomes for things like testicular cancer, but also just get rid of the stigma as well. Because I think there's still a big part of that when it comes to men's health, that you just put a brave face on, you get on with it, or it's nothing. That's not the way we need to be in the 21st century. We have to move with the times, and I think it's important to be able to relate to people. Though I think if they see somebody who's very scientific and the information's boring, I don't care what you say or who you are, nobody's going to listen. You have to do it in a way that relates to people. So I try to do that in my videos, is to make it really easy. Like I was talking to my mates down the pub. It's as simple as that, because we sometimes forget as doctors. I think we can be pretty bad sometimes, that we get into our own way and we use jargon and we don't even think about it. It's only when you've had a family member or a friend has come back from the doctor and they said I've got this mad thing called blah 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 blah. I'm like, I probably should have said that in an easier way that you could understand. And so I think the way to engage with people is to keep it very low key. Don't make a big deal of it, but do it in a language that people can understand. And like I said, I tend to find that the best way to speak to men is the way I would speak to my pal if I was sitting down having a pint in the pub.
Yeah.
And he said to me, I found this lump on my ball. It's kind of round the back. There's a wee bit there that I don't know if it feels normal or not. That is the way to do it, because once you start throwing out terms and names, that's great if you're a doctor or you're a surgeon or you're an oncologist trying to plan things. But for your average punter, they don't really need to know that. They just need to know what is normal and what is not, and when should you get checked. And I think if we just stuck to the basics and got that right, then I think we would be doing a whole lot better. So I love seeing guys like yourself that are really passionate about this, and like I said to you, it's great to collab. The last time I was in Scotland, we'd qualified for the Euros for the first time in like 23 years, so I had to go over, because going by the performances, I think it'll be another 23 years.
I think you're right.
But no, it's great to be here, and thank you so much for having me on.
No, it's great, and I think like I discovered you through one of your self-check things that you done.
Yep.
I think you had like kind of the plasticine.
That's right. Yeah.
Things like that. And I kind of followed you since. And obviously, like when I worked with the NHS, I worked in psychiatry. I worked in ITU. Then latterly, I was giving out the COVID vaccines as well. So a lot of the kind of like the misinformation stuff that you would kind of do as well. It was great to see from, like hearing your doctors, come out and go, no, see all this. I know. Just noise.
It's hard, isn't it? Because it's such a polarizing topic. So like, there's people that I could show the evidence, the medical evidence, and say, look, this is what this says. And they would still say to me, no, that's a lot of nonsense, or it's big pharma fudging the numbers and all that stuff. So look, you can only do what you can do, and you're never going to, one thing you realise when you do social media is you're not going to please everybody, and there'll be people that have so strong ideas that no matter what you say, they will disagree with you. But for me, it was important to do that, because I was having patients come in and say, no, I'm not going to take a vaccine. I'm not going to do any of this stuff because I've seen this video. And so I went through the video, spoke to them, and they said, oh, that's quite helpful, you've gone through that. And then I just wanted to do it on a bigger platform. But it comes with a backlash as well, though, so and look, when we give out any medicine or any vaccine or anything, it's all about risks and benefits, isn't it? There's nothing that comes with no risks these days. If any medicine, no matter what it is, comes with risks. So as long as people are aware of that, but it was a horrible time. It was hard to do those debunking videos because it took a lot of reading and a lot of going through science. But that definitely for people who were interested in learning. I think they found it quite helpful.
Yeah.
And then I kind of went on from there and did common things that people were asking me. So you were talking about the testicular cancer videos there. I think I did a series of about 4 or 5 that got really good engagement, and that got me working with a big company on social media called Pedestrian TV, and they did a kind of series with myself and then a couple of guys who'd had testicular cancer going through their stories, and it was a really great opportunity. It was really good to see that the hard work that you're putting in on social media actually gets out to people. And for me, like the kind of rewarding part is when I get just random people come up to me in the street. Sometimes I was in Zara in the Fort the other day there, and I thought a guy was coming up asking me for a size of the T-shirt, and I was like, "Oh, sorry, mate, I don't work here." And he's like, "Watch your videos, keep up the good work and all that stuff." And I was like, "Oh, man, it's just mad," because I don't do it for any recognition or for anything like that. Just genuinely do it to help people, because I'm doing it all day, every day at work anyway. So if it takes me 5 minutes to do a video and it helps somebody, then it's made a big difference. I
think you can see that as well, like with your videos. Like you can see, like because I'm a bit of a kind of TikTok stalker when I start doing my research. But from your first video to your latest video, there's still a passion there. You don't see any dip in you at all. You're giving the information out the way that you want to.
Well, but because, like I said, it's not like for some of the videos I have to put a lot of effort in. So, for example, there was misinformation about the ingredients of tampons a couple of weeks ago, and that to debunk that, it took me a long time, because I had to go through the study, actually read the full study, and medical studies are notoriously boring. They're awful. I hate them, but in order to actually make a judgment, you have to read the full thing. So people are looking at a headline in a newspaper and going, "Oh, that must be right," whereas actually, if you read into it and you look at it, it's not quite what they say. Newspapers are there to get people to read them and to make money. If they're going to put a controversial headline in, then that's on their kind of on their morals if they're going to do that. But it takes like 1 second to put a bit of misinformation out there, and it takes so much longer to debunk it. But like I said, I actually enjoy doing it. But most of the stuff that I do, that kind of stuff takes a long time. But most of the stuff is stuff that I'm saying to my patients on a daily basis in the way that I say it. I'm not having to practice or do 3 or 4 takes of it. I'm just doing what I would say if you came in with this condition, and how I would describe it to you, and what you should do about it. So a lot of the time it's not that much work, but for some of the videos it takes up a lot of time, and I think people don't realise, and this goes for all medical creators as well that are doing that kind of thing. There's a lot goes on behind the scenes where you're actually just sitting and you think, God, I've just spent 2 hours reading through all this stuff and to do a 30-second video, but that 30-second video is not the same as a lot of the other ones, because there's actually a lot of work going on behind the scenes. And like you know within yourself that you've done it as best as you can to get the right information across. Absolutely, I know. And again, look, there's always going to be people that will say, but you what do they say? You've been brainwashed. Your medical textbooks are brainwashed. There's all these kind of Rothschild conspiracies and all that stuff. Like, I'm the first doctor in my family, and I don't come from a long line of the establishment, if you like. I've got there's nobody I need to protect. I've always said to people, if there's stuff that goes on that's a bit dodgy in the medical industry, I would be the first person to say it, because I don't have anybody that I need to protect. So if you think I'm getting paid by Big Pharma, or you think I'm protecting somebody, then that couldn't be further from the truth. And I think that's probably why my content kind of resonates with people, because I come from a very working class background, and I'm a real person before I'm a doctor. I always try and treat people as human beings, and just two humans having a chat in a room about their problems, and seeing if you can at least make things a little bit better. I think that's where medicine needs to go now. I think the days of the old guy with the white coat pointing his finger at you and telling you what you need to do, they're just gone. That's just that's not the way we need to progress. We need to progress by making it open and honest, and saying, if we don't know something, we say, look, we don't have an answer for this. And that's not just about you going to see a doctor and he goes, I don't know what's going on here. I'm talking about with lots of symptoms that we can't explain. And there's lots of conditions right now, and we're just as frustrated as everybody else. There's lots of things out there where we'd be like, this is something like endometriosis. We know it's there. We don't really know what causes it. We're not very good at treating it. So We just need to sometimes put our hands up and say, look, the technology's there, the science isn't there for us to be able to do this.
Yeah.
And I think people would probably have a lot more trust in us if we do that, But that's something that, look, I'm not afraid to say I don't know the answer to that, because a lot of the time I don't.
Yeah.
But I know where to find the answer to that, and I think that's important. But certainly doctors being humans in the first instance and doctors second that's really important to me. And I think that's probably why my content works, is because I'm a real person, and I don't take myself too seriously, but I do take people seriously. When somebody comes in to see me in my clinic, the one thing that I try to do, even if I don't know the answer, because I'm not the best doctor out there, certainly not the smartest doctor. It was a struggle for me through medical school, but I listen to people. And I think if more people just listened and gave people time, then the world would be a bit of a better place.
Yeah, and I think we touched on this before, like the way that we kind of have to come across in the medical jargon and things like that, and using, especially when it comes to testicular cancer, and us going out and doing talks and like the wee cards that we've got that's balls, bollocks, nuts, and it doesn't say testicles once.
Yeah.
And I remember my dad and mum were nurses throughout the kind of 70s and 80s.
Yep.
And I remember when I first started, my dad had said to me, there's two different types of people you're going to come across. You're going to have old Jimmy who worked down the pits, and you're going to have old Mary who has got twin set on.
Yep.
And the way that you're going to speak to them is completely different. Yep. So, Mary, you'll have to say, could you, urinate into the receptacle for me? Or old Jimmy going, go and do a push in the bottle.
Yeah, absolutely.
And I really found that worked right throughout my working life. And when I joined Cahonas, and the fact that, that's how Richie wanted to go about it, not to medicalise it, just to be, Scottish guys trying to, encourage Scottish men to check themselves and take away that stigma and embarrassment.
Oh no, absolutely. As soon as you start mentioning testicles, I even actually, just me saying it, I'm like, it's just not something I would ever say to anybody. You know what I mean? Like, because unless I was doing a referral to a urologist about something, I'd say testicles. But look, it's got to be relatable to people. Like I think, especially Scottish guys, whatever you can say to them that's going to get them on side, sometimes you need to use a bit of humour, in some of my videos on TikTok, I found this funny video, and it was somebody with their camera, and they were videoing a chicken, and they went down the chicken and then up, and it got to it got to that bit. I don't know what that bit of the chicken's called, but it looked like a pair of balls.
Yeah.
And so I did that, and then I stitched my video onto the end of it, and I said, make sure you're checking your balls. And it's just something that's like shocking, but actually gets people talking about it. Like, oh, there's this video that a chicken looks like it's got a pair of balls, and it's but like you've been around the football teams recently. I did a lot of work with football teams, and these guys will not go and see a doctor unless somebody's either pushed them into it or they feel comfortable going to see that doctor. They just will put it to the back of their mind. They'll say, oh, everything's going to be all right, there's nothing. And I think, look, if we can change one thing, it would just be getting over the stigma of men going to the doctor about, any problem, but especially about lumps in their balls.
Yeah.
I use every word except testicles because I just don't think it's necessary, to be honest. Don't get me wrong, you might get the old, the odd kind of 70-year-old guy that's drives a Rolls Royce that comes in that says, oh no, my testicles are fine.
Yeah.
But, you play to your audience, but I would think that most guys in that age demographic, you've just got to resonate with them and talk to them like you're talking to them like their pal would.
Yeah.
So look, the practice I did a lot of work in here was in Springburn, and the word testicles there, I don't think I've ever used once. But it's just not necessary. But you got to find a way of getting into resonating with men, and it doesn't matter what way you do that. To be honest, I think as long as the outcome works, I don't think it matters what words you use or what terminology you use or how you describe it. I think as long as it gets them talking about it, that's the way. Yeah.
I think as well, like even like the stigma and embarrassment can sometimes, they might not be embarrassed by it, but we've had guys on the I think we're 20 odd episodes in now. We've had some guys on the podcast who I think even still within the medical profession, there's that stigma around testicular cancer that if guys phone up, you might get the odd receptionist who's the barn door holder,
absolutely,
or you get the GP who will say it's probably nothing, it might just be a cyst.
Yep.
And months down the line, it turns out that it was testicular cancer. I suppose it's, you as somebody who's proactive like that, hearing, that type of analogy, how can we try and then get GPs to be a little bit more proactive and actually helping guys?
When I hear stories like that, obviously it makes me really upset, because I just think that I've seen men with testicular cancer, and I've seen men with very late testicular cancer, and I just think, God, look, we need to be taking men seriously, because if you think about it, a young guy to come to the doctor with a problem, they've been sitting on that for weeks, if not months, and they've had lots of people in the background saying, you better go and get that seen to, you better go get that seen to. If they come in to see you as a doctor and you just go, that's all right, it's probably just a cyst, and you don't thoroughly examine them, you don't give them a follow-up plan, you don't explain to them what you think it might be or what you don't want it to be, then they're just going to go out and tell the families, the doctor said it was fine. And that's the end of the story. Whereas what you should be doing is saying, right, look, we've examined you today. We can feel a little lump round at the back. That could be an epididymal cyst, and it's most likely to be that. But what we might do is bring you back in a couple of months and re-examine you and just see if it's the same or not. But if it gets bigger in the meantime, or you get any pain in it, or you notice any other changes, then I want you to come back sooner. Or you say, we're going to send you for an ultrasound to make sure that it's definitely not. I mean, a lot of the time I am very liberal at sending people for ultrasounds, because I think not only is it good for the diagnosis, but it's good psychologically as well. Don't get me wrong, there are lots of lumps that we don't need to ultrasound. So things like varicoceles, which are the kind of varicose vein down the back. Some guys will come in and say, I felt a lump there, and I probably wouldn't ultrasound those. But for cysts, and certainly anything on the testicle itself, we have to be very careful, because that's a testicular cancer until we prove otherwise. Because I think the statistics are, of every 25 guys that goes to the GP with a lump in their testicle, I'm saying testicle now all the time, a lump in their ball, one person will have testicular cancer. So you think about a room of, if you went to see a couple of football teams, one of those guys in there, for every one of them, if they had lumps, one of them would have testicular cancer, which is pretty alarming, isn't it? I just think it's probably something that I think it's trivialised as well. But look, what I would like men to do is to, once a month in the shower, have a feel of your balls. Not because I'm expecting you to feel something abnormal. You might find something abnormal, but I want them to feel what the balls feel like normally. So that, look, let's say 2 years down the line, they're doing their monthly check in the shower, and they go, oh, that wasn't there before. How would you know that wasn't there before unless you checked it before? So those are the kind of things I'd like to try and get people into good habits. And it's not like we're asking them to go and show their balls to everybody at the football team once a month. This is in the shower, on your own, when you're nice and comfortable, just feeling around. We're not asking people to do a lot, but it just, until it becomes a kind of normalised thing and there's no stigma around it, people are still not going to do it.
And I think that's the thing as well. It's so easy to do. When I do the talks, I always say to the guys, there's no equipment needed other than your hands in hot water. That's it, really.
And I always say to people as well, look, if you don't want to do it, get your partner or your missus to do it. Like to be honest, probably your partner is the best person to do it anyway. If you're not going to do it, at least somebody's doing it. And usually, like I said, if you do it on a fairly regular basis, we want to know, we're not looking for something abnormal, even though you might find something abnormal. It's more to gauge what your normal is. It would be the same with everything. If you had a growth somewhere on your body, you'd be like, oh, that wasn't there yesterday. But it wasn't there yesterday because you looked at that part yesterday. It's about doing very simple things, because then even you go, well, that doesn't feel like it did last month, I better go and get that checked out, because then there's something to compare it with. Whereas I think a lot of guys will go, maybe that was there before, I don't know, but I'll just leave it and see what happens. Whereas I think if you see a change in something, you're more likely to go and get it checked. And
that's the kind of like the thing that we preach as well. It's like, what's normal for you. And when you're going into like schools and sports clubs, and a lot of kids are doing sport anyway, so that I always try to say to them, you could go for a sprint and then you feel that your hamstring is just a little bit tight, and you'll know your own body and you'll stop because you'll know that that's going to be sore. and you'll get it seen to, so why not do that with every other part of your
Absolutely,
body?
I know, and everybody is different as well. Everybody's anatomy is slightly different, and there are lots and lots of lumps and bumps that aren't testicular cancer. And I think that the main thing that guys need to know is that we're looking for a lump on the testicle itself.
Yeah.
There's lots of little structures in and around there that you will get lumps and bumps in. You still need to go and get them checked out. That's not to say you just go, oh yeah, I was listening to a podcast and they said that. No, we're absolutely not saying that. But any lump you find, if it's new and you've never felt it before, you got to go and get it checked out. And but certainly those ones on the testicles, if I get somebody in and I do an examination and I feel a lump on the testicle, I'll be like, right, that is a testicular cancer until I rule it out. And the only way you can rule it out is by doing the ultrasound and having a look at it, and then doing more investigations if you need to. Usually the ultrasounds are pretty good though. Where I work in Australia, I work in a little remote hospital, and we've got an ultrasound. Sometimes if somebody can't get into one of the bigger hospitals quickly, I'll do an ultrasound, and it's actually not that hard to do. I'm not saying that because I'm an expert at ultrasounds, but basically a cyst has got nothing in the middle and you can see right through it, and a testicular cancer has a blood supply, so it's thick.
And you can see that it's
exactly. And I think if any GPs out there are ever in doubt, because look, there will be, every GP is trained to see every condition. But probably most male problems will navigate towards male GPs, and most female problems will navigate to. In general, there'll be crossovers, but I think probably like I would be a little bit less confident if a woman came in with a breast lump or a lump anywhere else to somebody who would be seeing it very, very regular. So I think we've just got to make sure that if you're not confident with testicular lumps, you're either having some kind of follow-up or getting a second opinion, or making sure you're absolutely confident with a diagnosis. But certainly, look, listen to people. Give them time. Don't just, a guy comes in, sits down, I felt a lump, it's up the back, that's probably a cyst. That is just a nightmare consult, because that guy just goes straight up, goes out and goes home and tells everybody everything's fine. And I checked, I went to the doctor, said it was fine. But that's not a good consult anyway, and it's not the way I like medicine to be practiced. That's like fast food medicine, isn't it? Yeah. You're not like actually finding out who the person is, what's led up to this, who's worried at home about it, what's got you to this point to actually come in today, and examining people. You can't. I could not give you a diagnosis without putting my hands on you. Yeah. And there's probably old school people there that would go, oh yeah, no, you can tell a lot by the history. You can, but for you to make that important decision, you need to have all the information. And I think those consults where people don't get listened to, he'll just say to his pals as well, oh yeah, I went to the doctor but didn't really do very much. So if one of them gets something, then they'll be like, oh, the doctor won't do very much anyway. Yeah. We should be spending time with people, even if it is something that only takes a minute or two. I'm a big believer in trying to build that relationship so that if anything happens again in the future, let's say 20 years down the line, same guy has bleeding from his bum, he's probably not going to go and see that doctor again, because he's like, oh nah, they just didn't really give me the time of day, and it delays everything. Whereas if he went in and he had a good consult and he felt comfortable, then he'd go, I'm going to go and see that doctor, he was pretty good, I just wanted to see if everything's all right, or do I need anything doing. You see what I mean? It's building relationships. But the problem is with the NHS is that especially the 10-minute appointments in GP land are just too short. I feel like we're just kind of putting a Band-Aid on things and leaving it for later. Whereas it sounds silly. If you had an extra 5 minutes, you could actually do the digging and being like, right, how are things at home? Have you had your screening done? How's work going? How's your relationships? Because that's how you kind of build relationships with people and you get more out of them. But you have to invest that time. And unfortunately, I think in this kind of day and age, it's kind of been lost. And it just creates a horrible relationship between the patients and the doctors, because the doctors are rushing. The patients are feeling they're getting kicked out early as well. But I think it's just the system that's broken. I think everybody's trying their best, but it doesn't come across that way when you're going in and you're getting kicked out after 30 seconds of just saying, yeah, it's fine. Yeah. You know what I mean? That's not the way medicine should be. I think we actually just need to invest a bit more time in people. And that's one of my big beliefs. I try and just make sure that everybody that comes in to see me feels as if I've taken what they've said seriously, even if I have no answers for them. Or if I give them the answer that they don't want, at least I've listened and I've actually seen where they're coming from, and I can be really honest with them. I think people appreciate that.
Yeah.
But if you haven't got that relationship with people and you just come in and you tell them that there's nothing wrong, then that's raises a lot of red flags for me.
Yeah, I agree as well. Like, especially with the guys who have went in and have just said what's wrong, and the GP's not put their hands on them at all. You kind of go, how does that happen? But I think as well, like, one, we've spoke about this already, but Scottish men in general, we're rubbish at going to the doctors.
Absolutely.
And when we do, there's that little bit of white coat syndrome where the doctor said that, so even if they didn't feel confident that they were right, they would go, well, the doctor said it. And one of the guys who was on, Nathan, he quite mature, when he kind of had it in terms of, like, he was young but mature in his way of thinking, was kind of like, no, this definitely doesn't feel like how it felt like that. What's normal for you. He knew, and I think it was a firmness that was there. And he was quite adamant. I think he ended up going and getting a private scan.
I know.
And
it shouldn't be happening. I know. And that's the thing. That's what I try to do on my social media, is because, look, people need to, in this, especially in the NHS, people do have to advocate for themselves, because the system's not a good system to be in, especially if you're a guy and we were talking about this earlier on. If you're a guy that's found something like that and you phone the GP receptionist and they're saying, right, what's the reason why we're making this appointment, then it puts people in a position anyway, and you don't want to be blocking people's access to healthcare. And then again, if they turn around and say the next appointment's in 4 weeks, which is pretty typical now, 4 or 5 weeks, then what's the odds of that guy actually getting in and going to that appointment? So you've put something off that should have been dealt with sooner, that's probably not going to be dealt with, because in 4 or 5 weeks they'll be like, oh shit, I was supposed to have that GP appointment today, which is just normal. Like, that's happened to me before. It's probably happened to everybody. It's just human. But again, that kind of delays the whole thing. And then more often than not, if it is something that it progresses, it doesn't get any better on its own. But I think what I try to do on my social media channels is just give people the information. But I always say, you listen to your own body. If something's not right with it, then you need to push that. If you've been told that it's absolutely nothing, I would always advocate for a second opinion. Although a lot of people are scared to go for second opinions, I think you need to, because look, doctors are not perfect. You don't know what they've been doing that day. They might have been a bit frazzled, and they might have kind of missed something, and it does happen. Look, we're not gods. We're not robots. We're human beings. We sometimes make mistakes, but the way to negate that is either you go and see somebody else, or you go back in and you say, look, this isn't getting any better and I'm really worried about it, and advocating for yourself, or saying, look, is there any scans that I can get done? Do I need any other tests done? That's the way to do it. But I would say, if you feel something's happening to your body, no matter what condition it is, and you don't feel you've been listened to by the doctor, get a new doctor. Go and see one of the other doctors in the practice, or advocate for yourself. And look, it's unfortunate that guy had to go and get a private scan. That's just not on, is it? I mean, in an ideal world, none of that would be happening. But like I said, listen to your body. If look, there are times though, you listen to your body and you do all the tests and it comes back that there's nothing that we can kind of put a label on. That happens from time to time, but at least you can say, right, well, I did the full workup, I got the full head to toe, and everything came out all right. But when it comes to things like balls and feeling a firmness, like, I mean, they're red flags for me anyway. When I hear that, if I had somebody on the phone to me saying they had that, I'd be like, right, we're probably going to just need to send you straight for an ultrasound, to be honest. Like that would be enough for me to go, you need an ultrasound. But again, like, it's the system in Scotland just now is not the best for people, especially people like young men in Scotland who are less likely to go and get care anyway. If we are making them wait 5 weeks for an appointment, it's not going to happen. If we are asking them what the problem is and it's embarrassing, it's not going to happen. So I think we need to have a look at those issues and see how do we get around that. But yeah, look, young Scottish guys, I worked in football for years, and I think the only way that you can get these guys to talk is to actually build a relationship with them. And I mean, everybody should be nice to each other anyway, do you know what I mean? But if you're nice to people and you listen to people, a lot of the time they'll open up to you.
I think, and especially like when like we talk about the education part of it, and we are lucky that, you know, as Cahonas, we are trying to boot doors down, you know, anywhere we go, and we've been really lucky that we've not just got into kind of grassroots clubs, you know, we've been into the kind of top SPL teams as well. But to a team, there's always been somebody who's reached out and when afterwards said, I actually have had something because you had said and you gave your talk. I went and got checked. Thankfully, it was nothing, but even that education within a small group of guys has already gave somebody the confidence to go.
Absolutely,
to go and speak.
and that's the guys that you're hearing about. There'll be a lot of guys who you won't get back to you, but they've heard your message. Like I think that's the best thing about what you're doing is you're making it very relatable. It's low key. It's not a big song and dance about it. It's just like, look, this should be normal. Just check your balls in the shower once a month, and if something changes, go and get it checked out. That's like, let's not overcomplicate it. We don't need you to know the full anatomy of the testicles and everything that surrounds it. You know, once I start saying that to people, you've lost them.
Yeah.
I'll draw a wee diagram and I'll say, look, that wee bit that you're feeling at the back that you're not sure if it's normal or not. Well, it's called the epididymis. That just basically means it's a little collection of tubes at the back, and it's separate to the testicles. That's why you're feeling it and going, that doesn't feel like it's connected there. But doing it like that and not doing it like an anatomy lesson, I think is the way to do it. When I was before I knew it was coming on here, I was watching I just went onto YouTube and I put in testicular cancer just to see what the kind of mainstream or what's been spoken about there. And it was all very bland, you know, like 30-minute presentations on testicular cancer and very, very detailed stuff. And I was like, so I could just imagine if I was a young guy and I discovered a lump and I went onto YouTube and I typed in testicular cancer, that's the kind of stuff that people are getting served up. It's like an American urologist, like very, very intelligent guys talking a lot of sense, but not in the right way for somebody in Scotland. Do you know what I mean? They'd be like, nah, I'm not watching that.
And that's why I think like the way that, you know, when I started, I had to try and find my voice within the talks. And eventually I realised I was trying to do it, you know, quite clean, and I realised that's not not me.
Oh, exactly. Yeah.
So, and because of my own experience, then I just started making jokes, and you know, I'd always start off, you know, I understand the irony that my name's Paul and I've got one ball, you know, like stuff like that, and you see folk go, oh, okay, it's not going to be death by PowerPoint.
Yeah, absolutely. But the thing is, as well, if you're not yourself, people can smell it a mile off. You know what I mean? Like, sometimes in my videos when I'm doing the more serious ones, you can tell it's not really me. I'd rather just be like, I don't like doing the serious doctor stuff. I like to be like, you know, there's plenty of times that I need to be serious at work, but a lot of the time, you know, I can be just myself and speak to my patients and have a laugh and don't take ourselves too seriously. Don't get me wrong, that's not all the time, but I think if you're like that, people resonate with you and they go, oh, you know, that's not what you would stereotypically think like a doctor to be. But again, it all goes back to building relationships with people. And right now in the NHS, if you go to see your GP, well, first of all, you probably go and see a different GP all the time. You don't really have that relationship. You know, back in the day, in the old days where the GP used to go around to your house to see if you were doing all right or whatever, like, they would be known in the community, you know, so it's like it wouldn't have been as big a deal to go and see them. You'd be like, oh no, Dr. Jones goes to church and he goes round and makes sure all the, you know, all the people in the community are doing all right. It was more of that kind of feel. Whereas in the 21st century, it is more just of a very privileged job. It's not like a vocation that it used to be. But I think with that, you lose the relationship, and so you lose the. I think it's easier to just go, oh, no, yeah, he said it was fine, that's fine. But you don't really know this person. You know what I mean? So I'm all about, listening to people, building up a bit of trust, building a relationship so that when something does happen down the line, that they will come and see you and they won't just go, oh, no, I'm not going to go and see that guy because he didn't really give me the time of day. And
I think as well, you know, like the education part of it and what we try to do at schools, what hopefully helps, because like say you've got a 15, 16, 17-year-old who they're like, I'm going to go and be a doctor, you know, and they hear like a proper education about, you know, testicular cancer, you know, the signs and symptoms. And that's why we go in and we try and do like, again, keep it really simple. It's like, there's lots of kind of different symptoms of testicular cancer, but our 4 ones is the LIFE campaign. I don't know if you've seen that.
No, I've not watched
that. It's an acronym, and it's to check your balls for life. So it's lumps, irregularities, firmness, and enlargement.
Good. Yeah.
Dead simple.
Absolutely.
That you can check, and it's that's how you check your balls. Obviously, there's going to be other things within that, and we talk about what those lumps can be, but if we've got that interaction with kids at that 15, 16, 17, who then normalise doing their checks, who then when they go into GPs or nurses, doctors, in any kind of vocation, go, I've been checking myself for a while, I'm going to take this guy's word that this is different, and the education system needs to change as well.
Absolutely. We were talking just before we came on about the education system. I find baffling that we do not teach people about health that much. Like I could probably write on a piece of tissue how much I learned about the human body at school, and that's just not good enough. You know what I mean? Especially when we've got a nationalised health service, that you kind of want people to know how to deal with the simple things, so that people can get access for treatment for the more severe things, or when they need to. Because right now people don't really, the health literacy is at an all-time low. Like some of the stuff that people used to come and see me in Spring, I'd be like, right, fair enough, you came to see me, but that would probably be something that if it was me and I had a kid, like I would maybe ask my mum or my gran or something, like, oh, the wee one's been having this, what should I try first of all? I think all that kind of stuff's been lost. But where we should be making up for that is in school, teaching people, like, this is how your body works, this is how to treat it properly, this is what can go wrong, and it doesn't need to be masses, it just needs to be something that people can go, oh, right, I remember that at school, here's what I should probably do. But right now we're coming out and we were saying I learnt more about Pythagoras' theory that I can still remember to this day, that hasn't helped me in my life at all. The teachers at the time were saying, oh, this will be very useful for you. Absolutely not. But we're neglecting the important stuff. We've all got a body, we should at least know how it works. And you don't need to know in detail, like we were talking about with the fancy anatomy, but just look, what's the function of this, the function of that, what happens when this goes wrong, what happens when that goes wrong, when should you go to see the doctor, when should you not, just very basic stuff. Like I think it would make us healthier in general, but it would also help the NHS, I think, because you're actually educating and empowering people so that maybe they don't need to go to the A&E, or maybe they say, all right, well, I need to go and see somebody, but maybe A&E is not the right place. Maybe I'll go and make an appointment with the GP or go to an urgent care clinic or something, But right now I think people, I wouldn't ever blame somebody for going to the A&E or going to see their GP about something, no matter how trivial, because like I said, I think we've failed to educate people on what's normal and what's not, and you can't blame people if you're not giving them that education in the first place. Especially even like the kind of the satellite people that are around as well. It's like being like, people don't know what their pharmacist can do for them. Oh, absolutely. I know.
And I've been lucky that I've worked with some amazing pharmacists, like and there was this one particular woman, you could go to her with anything and she would just know it, and to be able to kind of use these services as well, I think, And I think that's where we were talking about the GP receptionists as well. Like, they do get a bad name, but I mean, it's hard because when you work on the other side of it, you can see the other side. Like, they're literally getting abuse from everybody all day, every day, and it's. But the problem, like, what they're supposed to be doing now is they've been trained to say, right, and the reason that because I've got lots of friends at GP receptionists, and I try and stick up for them because they're trying to do a good job in hard conditions. Because when people phone up, people expect to say, like you said, oh, I need to see the GP, and then they say, well, what's the what kind of issue is it or whatever, and they'll say, oh, I've hurt my knee. And they'll say, well, actually, why don't we get you in with the physio who's in on Thursday instead of you waiting 4 weeks for the GP? So that's where it's all supposed to work. But where it doesn't work is that people phone up and they go, oh, that receptionist asked me what was going wrong with me and all that, acting like the doctor and things like that. But that's what they're supposed to be trying to do, is like triage you into where is most appropriate. Do you know what I mean? But yeah, I get that it's a very touchy subject for people, but I've seen both sides of it. So it's hard, and it's a really difficult job. But don't get me wrong, there probably are some receptionists out there that are giving a lot of the other ones a bad name. But you can't tar everybody with the same brush, And I'm the same. I've heard it for the other side, and you get people who are just like, why should I tell you? You're just a receptionist. It's like, not realising that it's like, yeah, we are just trying to get you the right help.
But again, if you tell people that at school, then they know it. They're not just going to blow up when they go on the phone and go, that receptionist that's asking me what. But like that's where it all needs to come from. It needs to be grassroots. It needs to be teaching kids from a young age very basic stuff. Like, I'm not talking like they'll be able to go and diagnose themselves and go, oh yes, I've got a heart murmur there. That's but like just like how to look after yourself, like when things go wrong, what things to look for, and maybe break it down and say, here's what can go wrong if you've got a headache. Here's what can be wrong if you're coughing or you've got a sore throat. Very basic stuff. But instead of I don't know what subjects would drop out, but maybe home economics I didn't enjoy. Maybe drop that one out. I got
my higher on home economics.
But there's definitely things that you learn at school that are not helpful for your life. And I think if we just spent a bit more time on health in the body, then I actually think everybody would be better off. Yeah. And I just don't know why it's not happened. Yeah, it just doesn't make any sense to me. It doesn't cost anybody any money.
I think as well, it's odd that it hasn't happened because you've got guys who, like obviously, people who are my age going into teaching. Yep. Who hated the way they were taught, but don't fight against that curriculum. And you're going, it's the same. Change it.
It's the same. I mean, it's the same in medicine, healthcare as well. It's always like, this is the way we've always done it. Yeah. It's the number one phrase that I absolutely detest, because that is the one phrase that will make sure that nothing changes, and
nothing ever will.
No, exactly, and nobody seems to be kind of strong enough to push back and say nah, because you'll end up losing your job probably. You know what I mean? Like it's your job. If you suggest something and they say, nah, this is the way we've always done it, then you just go, fair enough, even though it's not the right way to do things. You see what I mean? Yeah. So look, I'm all about education. I think give people the information, let them make their own decisions. You know what I mean? Like if somebody comes in to see me and I say, look, you've got a cholesterol of 9, you've got high blood pressure, you smoke, you're really high risk of having a heart attack or a stroke, we probably need to start you on a cholesterol tablet. There's a lot of misinformation about cholesterol tablets and statins as well, and they say to me, absolutely no way, I don't want to take that medicine. Then I'll say, right, well, if you don't take that medicine and we don't address some of your risk factors, then you've got a 25% chance of having a stroke or a heart attack in the next 5 years. If they say to me, I absolutely know that I've got a 1 in 5 chance of having a stroke or a heart attack in the next 5 years, and I don't want to take that medicine, then they don't need to take that medicine. Yeah. But at least I've told them exactly the risks and the benefits. Now, I probably wouldn't leave it there. I would say, right, well, you won't take this medicine, but there are a couple of other things that we could try, or you could have a look at your diet, or what else can we do? But if they say to me, absolutely not, just like with the COVID vaccine, if they say, absolutely not, I'm not taking it, I'm not pushing it. Yeah. You're able to make that decision, you make the decision. But I think where we should be better is people understanding the where it comes from. So it's not like, oh, the doctor just wants to put me on tablets. Well, no, the doctor wants you to stop you from having a heart attack or a stroke because of all the issues that a high cholesterol and certainly a subtype of cholesterol will cause. Yeah. But I think again, it's always just like, it goes back to the big pharma and doctors just pushing medicines and things. And look, I've been saying the same stuff to my patients for years and years and years about diet, exercise, sleeping, stress, and it's not sexy. Nobody listens to me, I don't think. You know what I mean? When it comes to that. But when you get some kind of health guru on social media that comes up with it and puts it in a slightly different way, everybody goes, oh, that's great. Well, why are doctors not telling me this? I'm like, I have been telling you. It's just that you just listen to what you want to hear sometimes. It depends what part of your life you're in as well. Sometimes if somebody says to you, you need to lose a bit of weight and do a bit more exercise and you're in a pretty tough time, you're like, nah, I just can't do that. But if you're in the right part of your life, then you're more likely to do it. But I think we're getting back to it. At school, spend more time with kids on health, and it wouldn't cost anybody any money. It's probably it's probably going to have a good effect in general, not now, but maybe in 20, 30 years when all these kids have actually learned how the human body works and what happens when it goes wrong and where they should go when it goes wrong and how to use the NHS. There's probably a way to it as well. I think it would only be benefits, and I just cannot get my head around why one of the health secretaries hasn't said, let's do this.
Yeah, because it makes so much sense. It's that proactive way of dealing with it.
Yeah.
If you're going to get, this generation just now might still overly utilise the GPs or A&E in the wrong way.
Yep.
But if you're teaching kids, not just about their health, teaching kids about health, how they deal with their paychecks and taxes and stuff like that.
All the useful stuff, it's the things that you realise when you come out of school, you're like, man, some of the subjects that you did, you're like why?
Yeah.
You know what I mean? Like, it baffles me, and it doesn't need to be a lot of time. We're talking maybe an hour a month or something like that, not lots and lots of time, because again, I think with kids, if you give them too much information, they're probably not going to retain it. You want to give them bits and pieces that will actually just sit in their brain. Like, how many random things can you remember from when you were at school that pop into your brain that you're like, I can't believe I still remember that?
Yeah. My wife's one is always, she always talks about like when something comes up about osmosis.
Osmosis, yeah.
Have high concentration to low concentration.
For some reason, I always go back to the geography things and the erosion and everything in the rivers and stuff like that. And I'm like, this is just useless to me. Like, so you're learning things for the sake of learning almost.
Yeah.
Which is like, it all goes back to just give people the information and then they can make better decisions about their health, because I think a lot of the time, same with smoking, people smoke and they go, I'll be fine, right? But tell them why, when you're smoking, why it causes all these issues, and don't just be like pointing your finger and saying smoking causes cancer, because that just gets people's backs up.
I just go, oh, come on, they say
no,
that
exactly.
I
know. But no, it's all about giving people the tools, and I'm a big advocate in people making decisions for themselves. But you've got to have all the information. You know what I mean? And again, a lot of my social media stuff comes from giving people the other side to an argument where they've watched something and it said, don't take chemotherapy because you should just take this supplement and it will get rid of your cancer. I mean, obviously, if that was true, then nobody would have cancer, would they? Yeah. But at the same time, I want to give you the other side to say, right, here's why that doesn't work, but also why you shouldn't just rely on natural supplements, and you should actually go and see a doctor, get the full workup, and go with the trusted treatments that have evidence behind them, because it kind of breaks my heart sometimes with social media. I watch stuff with people that have had cancer, or young mums who are they're in a kind of vulnerable state. Like people that have been diagnosed with cancer will look for any kind of anything that they think might help them. They're quite vulnerable. And so I think they're kind of targeted by these these kind of snake oil salesmen, which I think is just like morally wrong, but also there's no recourse for them. Like if I went on social media, gave somebody wrong information and they got harmed, I mean, I'd get sued, rightly so. Whereas these kind of natural gurus don't get any recourse at all. They just disappear.
And they just can be like, well, that's just what I
thought.
I know.
But it does break my heart. And one of the times I did, I spoke about this on my TikTok a few months ago. I had a guy who had testicular cancer who didn't want treatment. Right. And like, no matter what I said to him, he saw a few doctors and was doing alternative treatments for testicular cancer, and it was just spread everywhere, and really sad for me to see, because like I said, we're human beings first of all. If you see somebody coming in that's absolutely riddled with cancer and they're coming out their skin, and you know that there's a treatment that 95% of the time will completely reverse it. It's just very, very difficult in that situation, because I know people can make their own decisions, but where's the information that they're getting coming from to tell them to make that decision, if you see what I mean? Yeah, no, definitely. But it breaks my heart. I went home from work a couple of times when I'd seen him and just thought, God, this is awful. And it's not just awful for him; it's awful for the family, and because it's painful and it's suffering, and people are easily influenced by things they see on social media, and that's where I kind of feel like, as a doctor, it's a bit of a responsibility to say, right, well, you might still listen to this person, but here's the opposing argument. Yeah, and I think that's all you can ever do. I remember, like my uncle saying to me, he when he's listening to the news, he listens to everything. He'll watch Al Jazeera, but he'll watch CNN or he'll watch BBC to get, and he said, and anything that they all say is the same.
you can guarantee is probably true.
Yep.
Everything else is
No,
just
absolutely.
noise. And it's a bit like that with these kind of snake oil salesmen who try and kind of push. I can't believe that, you know, like all the evidence that's out there for, you know, how chemo will help you with your testicular cancer, that he chose not to, you know. It's
no, absolutely.
Yeah.
I saw him maybe so I saw this guy maybe 3 times in the space of a month, and like every time I said to him, I just said, you know, I just felt like I was a broken record, but I was saying the same things, and his family was in with him, and they're saying, yeah, we've told him all this, he understands this, but I mean, like, because when testicular cancer is not treated, it will spread everywhere. And then, you know, this guy had, it was just so sad, he had what's called skin metastasis, which is where the tumours have started to spread into the skin, and you get these kind of balls under the surface of the skin. Very, very painful, because they push on all the structures underneath. And I spent a lot of time thinking about that guy, and I just cannot, you know, it's, again, everybody can make their own decisions, but I just can't, you know, kind of felt guilty that I wasn't able to say something to make him consider changing his mind. But that's just probably, it wouldn't have been possible, you know. But I'd love to have known where the information came in the first place that led to making that decision. But yeah, it's just so sad. But that's why I'm a big advocate for watch your conspiracy theory videos, or watch your alternative treatment videos if you want, but watch the other side as well.
Yeah.
And then just, you know, if you still go with that and you say, no, look, I don't want any treatment for this, I'm going to take castor oil or, you know, sour soup or whatever anybody's taking these days, then go ahead. But look, why don't you hedge your bets and do both?
Yeah, exactly.
You know what I mean? It doesn't need to be an all or one. Like, people come in to me and they say, I read up on this alternative treatment, and I was just wondering if I could take it when I'm taking my chemo. I'm like, yeah, look, it's not going to do you any harm. It might help, but that's the way to do it. Don't discount the tried and tested treatments, even though, you know, people try to give them a bad name and say, oh, chemotherapy, you know, makes the big pharma lots of money. I mean, I think big pharma would probably make more money if they cured people and let them live till they were 120 on 10 different types of medicines. I think if big pharma was going to make money, that's the way they would do it. Yeah, they wouldn't have people passing away at a young age. Yeah. But look, those kind of conspiracy theories go wild and far, and there's nothing I can say to people that believe in them that they're not true. Yeah. Even though I know they're not true, you know. But it's all that kind of stuff. But look, I think a lot of people give these alternative treatments, they don't give them the same the research as what they would do for your traditional medical things. So people would come in and say, oh, this treatment has all these side effects and all this stuff, but because that one's natural, they don't really look into that. They just think because it's natural, it's good for them, but sometimes that's not the case. So I wish people would just have a bit the same skepticism about one as the other. And it's true. Look, there are, not everybody's different. Every human reacts different to medicines that we give them. So some people might run into side effects, and we can't predict who that's going to be. That happens, but I wouldn't let that experience taint your view of the whole of modern medicine. You know, it's not. It doesn't work for everybody, and some people run into some side effects. But I wouldn't use that as a justification to just go, oh, do you know what? I'm just going to go down this route. But certainly, people get all the information and make your decision from once you've done that. But don't just listen to these alternative things, because you know what will happen? You'll watch one on TikTok, and then the next video will be something very, very similar, and the next one will be similar, and before you know it, you've gone completely down the rabbit hole, and you've never even considered this other side. And that's kind of why algorithms make you so addicted to social media. It's the same with YouTube. You watch one Joe Rogan podcast where he's got somebody on talking about something as silly as like not landing on the moon, and then you know the next video is like another conspiracy and another one, and everybody likes a good conspiracy, but you need to be able to pop back into the real world and go, right, watch the videos where the guys are debunking the conspiracies as well, and then you know you're probably going to think, right, somewhere in the middle, or at least have considered that other side. But I think most of the time these days people are just so into the quick scrolling on TikTok that as soon as they see something that kind of confirms their bias, or they go, oh yeah, I always knew that was bad for you, the next video something very similar, and then they just go down the rabbit hole. And again, it's very, very difficult when they come in to see us in the doctor's surgery, and they've completely brainwashed themselves into thinking that everything's bad and there's no, like, you know, and there's nothing good in modern medicine, and it can be quite difficult sometimes. But again, people can make their own decisions, but big believer in look at both sides.
Yeah, I mean, when I was going through my treatment, the amount of messages that I got for, like, you know, like through Facebook and stuff, friends and family, have you thought about trying cannabis oil? You know, it's so much better for you than, and I'm like, no, I think I'll just stick with the chemo.
It is difficult though, isn't it? Because it's because again, it's quite a vulnerable time in your life. Yeah. So like when people are reaching out and saying, "Oh, I had this guy that took this and he was completely cured," like, you know, it might not have grabbed you, but you can imagine it grabbing some people and being like, "Oh, do you know what? I'm going to do that." But
especially if you go through multiple rounds of chemo, because it's awful. Like, don't get me wrong, you know.
Absolutely.
You feel absolutely horrible, but you know that, like, I had this. I don't know if you'd ever met her, but there was a Spanish consultant at the Beatson.
Right.
And when she came out, she was like, "Paul, we're going to give you the big guns." Right. And I was like, that's what I want. I want the big guns. I don't want, you know, a leaf.
I know. But like I said, like you were saying there though, because I've worked in the Beatson as well, and the side effects of the treatment are horrible. But they work. Yeah. You know what I mean? And and there's people for years after have got side effects from the chemo, and radiotherapy has its problems as well. And look, it's not perfect, but you know, the alternative's not. You wouldn't want to be even thinking about that. You know, that's so if you're not taking that, then you know your life's going to be shorter. Yeah,
I think as well, especially when it comes to testicular cancer, and the people there is again a thought in testicular cancer that people go, "Oh, it was just testicular cancer," because the numbers aren't big. Yeah. But it's affecting men at the prime of their life. But also, there's been deaths because of testicular cancer that you kind of go, that's so, it's not completely avoidable because you could be really proactive and catch it early, but still obviously pass away because of it. But I think when you got these things, it's like you have to kind of be sure of what you're telling people.
Oh, exactly, I know. You know, but it all comes back to them not having any recourse. You know, if somebody follows their advice and then passes away, then nobody's going to turn around and go, "Oh, we need to find that person and sue them." You know what I mean? It just doesn't happen. It's like they just keep doing their own thing, and they don't even know, because like they're not seeing patients face to face. They're just giving out information online, and whereas we see them face to face and see the effects of the treatment and whether it's working or not. Yeah. But it's hard, because people that have just been diagnosed with cancer are in a vulnerable state, and open to, unfortunately, snake oil salesmen as well. But
and especially the age as well. If you're, you know, in that young age range, you know, my head was fully broken biscuits when I was in my 20s. I would, you know, I would believe quite a lot of things just because I read it, you know. So.
I know, and I don't think people. I think people are probably reaching out to you and saying those things, you know, with good intentions. But I don't think they realise the damage that it does as well. In that it kind of puts doubts in your mind. Oh, should I just take this cannabis oil instead? Look, don't get me wrong. I use cannabis oil for side effects to chemotherapy, for the nausea, in people that are wanting to use it. I mean, I don't think it's particularly any better than some of the medicines that we would give you for anti-nausea, but some people are really convinced of it, and I say, look, fair enough, go for it. But it's good to have a discussion, you know. Like if you go in and see your doctor and you say, look, I've been thinking about this and this, and here's why I've been thinking about it, and just go in and be honest with them and say, look, this is what I've read, this is where I got it from, what do you think? And they might not be able to give you an answer there and then, but like what I'll do sometimes, if somebody comes in with a study of something that I've never heard of, I'll be like, look, I've got absolutely no idea what that means, leave it with me, I'll have a read of it, and then I'll give you a phone back, or I'll get you back in a couple of weeks and we'll have a chat about it. Because look, there are things out there. It all goes back again to me when I'm talking to my patients. If you take everything back to basics, if you're in chemotherapy, you need to make sure that you're trying to get enough rest, you're sleeping well, you're eating well, you're keeping yourself as strong as possible. If you do all those things, then that's giving yourself the best possible chance of being strong the whole way through. But people are going to get side effects, you know, and we can't predict who. If we could, it would be much easier. It would be like, oh, by the way, you're going to feel really crap after this, and you're going to get neuropathy, or you're going to feel nauseous every single day. But we can't. And so it's you know, and then when it happens, they're like, oh, that made me feel terrible. I'm like, well, yeah, it's just like, it's not perfect, but it works.
And just when you were talking about side effects, I was going to ask about that. One of my side effects that I've got, I had tinnitus anyway,
Right,
but during the chemo, it was like a vulture screaming in my ears, but it still exists. You know, we've had guys who have got the peripheral neuropathy and things like that. Just with those type, even though there's nothing that can be done to prevent them, but is there anything that, you know, like especially for guys who've got the peripheral neuropathy, is there anything that helps with those side effects? Is there?
So neuropathy is basically just where you've got damage to the nerves. So the issue with nerve pain, and that's what it is, neuropathy is a nerve pain, is that it takes a very, very long time to recover. So something ridiculous like a nerve will heal at 1 millimeter per week. So if you've got neuropathy from here to here, let's just say here to here, what's that? Maybe 25, 30 centimetres. If you work that out, how long it would take for that to fully resolve, for your nerve to heal from there to there, it's a very, very long time. And it doesn't respond to your normal pain medicines. So opiates, absolutely no, doesn't work at all. Paracetamol won't work. Ibuprofen, anti-inflammatories don't do anything. So the only way that you can kind of take the edge off it is to actually use a medicine that's specifically for nerve pain and neuropathy. And again, not perfect treatments either. They've got their own side effects. But that's probably what was causing your tinnitus as well. It would have been neuropathy of the nerve in your ear.
Right, okay.
Very, very similar. But it's just it's awful because we do see, like I said, I've seen the fallout when I worked in the beats, and some people would just bounce back absolutely perfect. No side effects at all. Some people would have the neuropathy for a long time, and it should technically get better with time, but sometimes it doesn't. And if it's debilitating and it's really bad, then you probably need to have a look at some medicines and have a chat with your doctor about what's appropriate or not. But it's just a horrible side effect. I mean, it's one of those things with chemotherapy that I think bothers people the most because it tends to hang around for a long time. Don't get me wrong, in the future I think we're kind of looking more at, there's been a lot more use of immunotherapy. Don't know if you've heard of that, where basically they're taking your blood and putting it in the lab and stimulating it against the cancer and then re-injecting it, and that doesn't have the side effects that chemotherapy does, because chemotherapy's not a specific treatment. It's basically just going around looking for cells that are dividing really, really quickly. So that's why your hair falls out. That's why you get lots of GI upset as well. So it's not a perfect treatment by any means, but with the evidence we know it works. And those side effects are, like I said, anybody that I've seen that's had them, can be quite debilitating as well. But the only thing that helps is time, and sometimes using medicines to make them feel a little bit better. But I know that's not the answer you want.
No,
I know this,
not
and I say this to people all the time. I'm like, look, I wish there was something that I could tell you but I quite like being completely transparent with people and saying, look, this is a horrible side effect. It's probably going to take a long time to go away, and we'll just play it by ear and see how things go.
Is that a potential death?
Well, I know. But I think once you've gone through and you're in remission and there's a cure, it's quite hard to think like that. If you see what I mean, I think people kind of go, right, I'm better, but now I've got neuropathy, and like I said, it's just like a psychological kind of up and down. But it's hard. And it's like I said, I've seen so many people with different regimes of chemo. Some people fly through it, some people don't. And we don't know who's going to fly through it. We don't know who's going to struggle. I think that's a difficulty.
And as well as that, you've got some guys have longer lasting kind of low testosterone effects. Is that something you've kind of come across as well? Or
that's tricky. I know, because they actually find that your testosterone might be low even just as a result of the treatment. So not because technically, if you lose a testicle, you're going to get enough testosterone production in the other one. It's not always the case, but they think that from chemotherapy traditionally affects your fertility as well, and your testosterone levels, again because of those cells that are producing the testosterone in the sperm. So there's all that, but again, you brought it up. It's such an important thing for people to remember, because like I said, when young guys that come into, they won't even be thinking about, they might not be thinking about having kids or later on in life. So it's something that they really need to think about. When you're losing a testicle, you need to make sure that you're actually doing something with some sperm, just as an insurance policy. So whether you're getting the sperm harvesting just so that you can it may well be that your testosterone levels go to normal and your sperm levels are normal after a while, but you don't want to take that chance. Because, a 20-year-old guy might go, well, I'm not really that bothered about having kids. But then, when they hit 30, 35, they might be like, I wish I'd had the option.
Yeah.
But yeah, no, it's a tricky one. I've seen the whole spectrum. I've seen people that testosterone levels never climb, and then they have to go and see an endocrinologist and go through all that stuff. I've seen people that it goes up slowly over time. And I don't know whether it's very, very difficult to work out whether it's due to the chemotherapy or whether it's due to actually the removal of the testicle. And then I've seen people bounce back and never have any problems.
Yeah.
Like people that they never get a dip in testosterone anyway.
Yeah.
But depending on what level you're at will depend what the treatment is. But I always feel sorry for the guys that are kind of in the middle ground, because you're not quite at the point where the endocrinologists want to get involved and start some treatment to stimulate things, but you're still feeling like crap. Yeah, you see what I mean? I know. Because that's a problem. It goes into those categories, and then if you're in that middle category, what the endocrinologist will say is that the risks outweigh the benefits of giving you the treatment. Yeah. Which is again not what you want to hear. Did it eventually go back up?
So my testosterone levels, my last check, were below average,
right,
and then just above. So I think, I don't know if this is the right numbers, but say these are the numbers. So it was like 9 and 10, and then my second set went up to 12.
Okay,
and then I needed a new fasting bloods, but then it dropped back to 9.
Right.
So
Okay.
So it's kind of always been kind of fluctuating, and there always is obviously going to be fluctuation depending on how much sleep you get, what you've eaten before.
Do you know, because this is a very specific question, you might not know the answer to it. Do you know if they did your other hormones, like your FSH and your LH?
Yes,
right.
They did. I can't remember what my...
Basically, for people that are watching this, they'll be like, what are you talking about? Because you've got hormones that are released from your brain to tell your testes to produce testosterone. Yeah, I said testes there as well. That's even more
nice.
medical. So basically what you want to work out, is it a problem there or is it a problem there? Because you can get shut down of the whole thing, and it will dictate what type of treatment that you can use. But when you're 9, you're just below the kind of lower level of 10. 12 would be all right, actually. Most people would be there, but it's a difficult one. You've probably watched on social media. There's so many people just going, just go on testosterone replacement therapy.
Yeah, that's so scary in that.
I know, but it's been so trivialised now that people I get guys coming in and saying, I need to go on TRT. I'm like, right, okay, why?
Yeah.
I'm like, I would get guys coming in that testosterone was 12 or 13. I'd be like, right, how do you know if we bump this up to 18 or 19 that you're going to feel any different?
Yeah.
It's only the guys that are bumping it up to the kind of super physiological levels. So they're saying they're on TRT, but they're actually bumping it right up, which will be the guys who feel really, really different, or the older guys that have had it go really low. That they'll feel a bit of a difference. But it's give and take. If you want to go into testosterone replacement, then you're probably going to be on it for the rest of your life.
Yeah.
You got to think about your fertility as well. All these considerations that people don't think about. I watch social media and there's like these guys on reality TV, 20-year-olds saying, I'm on TRT. I'm like,
why?
Well, exactly. I know. What? So you can lift a bit heavier in the gym. It's just an excuse for some people to be on steroids.
Yeah,
what it is.
We had that discussion with my GP, and that was one of the things they said is like you do get a lot of people coming in and just want to go on it for that.
Yep.
But I was quite lucky that we went to the Germ Cell conference here a couple of years ago, and one of the professors talked about. When I was sitting, I was like, he's talking about me. That like your bloods and your physiological appearance don't look like you have low testosterone, but you might have other symptomology that could say that. So I was lucky that being fortunate in the position that I'm in and be able to kind of communicate with the beats in a kind of different way. My oncologist, who's now retired, emailed my GP, and then they referred me back to the Beatson.
Okay.
So now that I'm back in the Beatson, this professor's got this new study. It takes about 9 months before you're even seen. But even just to have the question answered and see if they come back and go, Paul, you're fine. I'll go, all right. it's other aspects that I'm needing to kind of. I mean, clearly I'm overweight, so that's not going to help.
Well,
and things like that.
So again, whenever somebody comes in to see me for something like that, it will not just be a, can I get TRT, and me going no. It'll be like, right, what has led you to this point, and finding out what's going on behind. And look, there are a lot of ways that you can raise your testosterone without having to go on TRT. And I think if you have exhausted all of those and you think, nah, I've tried everything I can, I'm sleeping well, I'm not that stressed, I've lost a bit of weight, because like the weight is not something that we like talking to people about, but we know that the more fat you've got, the more estrogen you're producing, so it affects your testosterone levels. Anyway, don't want to get too scientific into it, but if you can just get back to the very basic stuff, sleeping well, eating well, losing a bit of weight, exercising, shifting some weights, then if they're not going up, then you ask a question. You say, look, for the last 6 months, I've tried this, and this. Can I get my bloods checked again, because I don't feel any different? And if your levels are still low there, then that's when I'd be saying, right, let's get you to see an endocrinologist.
That's what led me to go back to my GP, because I was probably about 8 or 9 years out at that one, but 7 or 8 years out at this point, and I had done a couple of runs for like the Great Scottish Run.
Yep.
I was training, I was going to the gym, and in a month I'd maybe lose like 3/4 of a pound. I'm going, how am I not shifting any weight? And not sleeping well, and so, but then it just spirals into that I'm eating like a 5-year-old, and it's just Haribo's. Do you know what I mean? It kind of gets
it's tough. Look, but again, I think sometimes people will, certainly young guys that have come in to see me and videos I see on social media, they think that the testosterone replacement therapy is just a quick fix. I mean, it is a quick fix because it'll put your testosterone up, but you'll need to be injecting yourself once or twice a week for the rest of your life if you want to stay with those testosterone levels. And also you get, your balls at that point are kind of redundant, so they tend to shrink and not do very much. So there's all these things, and again, if people are like, so if you came in to see me in 6 months' time, you're like, Mike, I have been sleeping 8 hours a night. I'm not that stressed. I feel great. I am eating well. I've lost a couple of kilos. Let's see what my testosterone levels do now. And if it stayed at 9 or it's down to 8 or whatever, I'd be saying, right, why don't we just get the opinion of an endocrinologist and see what your options are? But again, I think the problem is with social media in the 21st century is that everybody wants things immediately. You can go into your phone and get an Uber. You can get food delivered to your door. You can buy stuff from Amazon, it will come tomorrow, but medicine doesn't work like that. And I think people are frustrated by it, but it just, we're only like 100, 150 years into modern medicine. We're still very early, we've not got the answers for everything, and certainly we can't do things that quickly in a system like the NHS. I
mean, really not that long ago, people were still driving about in a horse and cart.
Oh, absolutely. I know. Some of the treatments that doctors were doing was pretty crazy as well. But I think the thing for guys that are watching this just now and they see somebody on going, oh, I've gone on TRT and I feel great and everything, just don't, the guys that are on TRT that feel crap will not be putting a video up on social media. It's all the guys that have got good effects from it. So just try and take a backward step and say, right, why are these people on it? What else can you do to raise your testosterone naturally? And why don't you do that first? But it's hard work. That's the problem. It's hard work. It's not easy. But TRT is a big discussion point I have with a lot of my patients these days, because I do it for some people, but it's not for everybody. Certainly not for everybody. And it's not just I'll just go on TRT, because it comes with its own problems.
Of course. Mike, I could talk to you all day, mate. Honestly, thank you so much for coming on. And next time you're over, maybe we can do this again and
absolutely,
and cover stuff if not.
I know, we've just been chatting away about everything.
And I've honestly thoroughly enjoyed today. Thank you so much. Just as we're signing off, anything you'd like to say to guys who are going through treatment or hopefully are going to look at this, and if we edit it up, can make them feel confident to go and see a GP like yourself.
The main thing that I'd say to guys that are out there, first of all, is get in the habit of checking yourself. Don't make a big deal out of it. Just once a month, or if you can remember, once every couple of months, just get in the shower, in a nice hot shower, feel your balls. If something feels different, go and get it seen to. But you're better knowing what your balls feel like normally than all of a sudden feeling something and going, oh, I'm not sure if that's normal or if I've never felt that before. So I want people to know what they feel like normally and what's normal for you, because everybody's balls will be slightly different sizes, different bits and pieces going on, but feel yours so that you know if something changes, you can really go, oh, I didn't feel like that last month. What's going on? And then you can go and see your doctor and say, look, I feel my balls regularly. This wasn't here last month. It's changed in the last month, and that'll make them go, oh, there's something going on here. Second thing I would say is when you try to make an appointment for your GP, don't be put off by either how long it's going to take to go in or if they ask you what's wrong in the first place. Look, as doctors, we have heard everything before. We've seen everything. There's no need to be embarrassed. There's no need to be scared either, because testicular cancer, if it is that, has got a 95% cure rate, no matter if it's in your balls or it's spread to other places. So I think people sometimes are get a bit paralysed because they're worried about what will happen after that. But not every lump on your testicle is going to be a cancer, but you need to make sure that you're not the person that has the cancer there. And look, I would say if you go to your GP, as we were speaking about before, and you feel like they don't take you seriously, go and see another one. You're entitled to a second opinion. Don't just leave it. If somebody, if you are worried about something and your family are worried about it and they're telling you to go see your GP and they completely dismiss you, then don't take it. You need to advocate for your own health and listen to your body. And once you've had somebody who's actually thoroughly examined you and told you exactly what's going on, then you can either be reassured or not, or sent for more investigations. But don't let people put you off. I know that the NHS is a bit of a stressful place just now, but that's not an excuse for people rushing you and not examining you properly and not listening to you. And if you feel like you haven't been listened to, or you feel like you've not been examined properly, then go and make an appointment with another GP in the practice. And if it happens again, then you can take it a bit further. But it's certainly, I would not be leaving it, because if you feel that there's something wrong with you and you haven't been taken seriously, then yeah, that's going to lead to some bad outcomes. And ending on a bit of a happy note is that, look, we're all in the same position. No matter whether you're 15 or whether you're 65, you should be checking your balls. It's something that should just be normalised. I think that as guys, we're notoriously bad, especially Scottish guys. We're still in the old-fashioned way of thinking, I'll be fine, or it's nothing, I'll just put it to the back of my mind, or it's going to the doctors for wimps. It's not the case at all. I think until we start normalising that we actually take a bit of interest in ourselves and actually looking after ourselves is not less manly than if you just put it to the back of your mind. So I think listen to your body. It doesn't, and it doesn't go for just testicular cancer or lumps in your testicles. We're talking about anything. If you feel like something's happened, you feel different, go and speak to somebody about it, because you know your body better than anybody else. And I think, go in prepared to your GP as well, because I've been to see my GP before and I've had all this stuff ready to say, and I go in there and I'll be like, oh, all over the place. So if you need to write a list, write a list. If you just need to write a few pointers, write a few pointers. But it's quite hard sometimes. You get a bit nervous, you get a bit hot on the collar. I certainly do when I go to see my GP as well, because I'm always thinking worst case scenario. But have some pointers or bring somebody with you, because if you kind of forget what you were going to say, then you're not going to get very far either. And look, I think we need to give people, the GPs, the most information that you can, so that they can make decisions as well. And if you go in and just say, I've got a lump in my ball and I can't really remember where it's been since, and blah blah blah, the more you can describe it, the more you can explain what kind of time frame it came over, and then the more that'll be better information for your GP to actually be able to make a decision about. Yeah. And the other thing as well, I would say, look, we've not touched on this, but if your mum or your dad told you that when you were a kid you had an undistended testicle, so your ball was in your tummy for a bit longer and it didn't come down till later on, then you are at higher risk. And I think that's a lot of things that people don't really talk about. But it's again, it's not really something that you would talk about unless it's specific to this.
Yeah.
Because in what other area of life, would you say, "Oh, I had an undescended testy when I was"? It's very, very relevant to this conversation. So if your mum or your dad had said to you, "Oh, I think you had an issue with your ball not going down into your into your scrotum when you were younger," then that's very, very relevant, because again, that increases your risk by quite a fair bit. But it's just an aside. It's just something that you might go, I wonder if that's relevant or not, but it probably is.
Yeah, no. But no, thank you very much.
But yeah, just look after each other.
Yeah.
And I think I'm hopeful that in the next 20, 30 years that Scottish men will be a bit more open about their health. And actually, I think we're getting there very, very slowly, but it's still slow progress. And you don't need to be this hard man because you don't like asking for help. No matter what it is, always ask for help. And like I said, just let's try and set a good example for the younger guys that are coming up and get into good habits.